So a snide remark at school, oh, I should just go kill myself, or oh, I'm gonna kill that kid. All of a sudden it goes into a depression inventory. Are you sad? Do you feel blue sometimes? Do you feel like you don't want to get up in the morning? Yes, I do feel that way sometimes. Okay, you need to be Baker acted. Hi, I'm Dr. Brenna Hicks, the Kid Counselor. When I meet with parents at my practice, they almost always tell me they wish they could crawl inside my brain so they could absorb everything that I know about kids and parents. As a result, I started this video series so that you can get the benefit of my insight into kids and how to effectively parent them. But most importantly, you get my perspective into your children's struggles viewed through the lens of play therapy. Hi, I'm Dr. Brenna Hicks, the Kid Counselor. Today I want to share with you something that I think is so important for you as a parent or a grandparent or a caregiver and someone who loves children in your lives. I think this is so relevant and so important to what is happening in our country and in the mental health space right now. In Florida, we call it Baker Act. In other parts of the country and other parts of the world, it's termed differently, but it is essentially the involuntary commission of people to mental health facilities for their own safety or the safety of others. So in Florida, we refer to it as Baker Act, and for the rest of the video, I will call it Baker Act, but please understand that in your state, it might be called something different. In your country, there might be a different name for it. But it is essentially when someone is committed involuntarily to a mental health treatment facility because they are deemed a risk, a safety concern, they're going to hurt themselves or someone else. And here's why I bring that to your attention, because you may think, what does that have to do with kids? But there is a growing trend where children are now being Baker acted. And kids as young as 5 years old are being taken, often in a police car, in the back seat to a mental health facility. Parents are not necessarily being notified, and school resource officers and teachers and principals and staff at different locations are making the decision that yes, this child needs to be involuntarily committed. And a growing concern for me as a clinician and as an owner of a private practice that deals exclusively with kids is that I have an increasing number of parents who are calling or emailing me and saying, should I Baker act my child? XYZ is going on, they're completely out of control, I can't rein them in, should I Baker act them? And I feel that it is my duty and my obligation ethically and personally and clinically to let you know what that means, what that looks like for your child, and why at all costs it should be avoided. I think it's important to share a disclaimer. I am not undermining the work that is done at these facilities. I know that those are necessary in certain situations, and I know that they serve a purpose and that it is helpful for people who are genuinely at risk or genuinely thinking about harming themselves or others. My point in this video is specifically for children being Baker acted and what that means for them. Unfortunately, the general public, parents, teachers, the people that would make the decision on behalf of the child are typically not aware of what goes on when they get there, and they're not aware of how traumatic those experiences can be. So it is my hope that through this video you will understand what that looks like and therefore be able to make an informed decision, an informed choice if something like that would ever happen. The foundational component as far as my concern is that children are committed for 72 hours. There is a mandatory 72-hour hold. They will not be released until the doctor releases them and signs off on their discharge. So a snide remark at school, oh, I should just go kill myself, or oh, I'm going to kill that kid. All of a sudden it goes into a depression inventory. Are you sad? Do you feel blue sometimes? Do you feel like you don't want to get up in the morning? Yes, I do feel that way sometimes. Okay, you need to be Baker acted. And by one comment, they are then in a facility for 72 hours and no one can remove them unless the discharge paperwork is signed off on by the doctor. So 3 days away from home from sleeping in their own bed, from eating their own food, from going to school, can be extremely scary, extremely overwhelming. They are often strip searched. They have all of their personal belongings removed. They often do cavity searches depending on the severity of why they came in. They are required to meet with social workers or counselors. They are required to meet with nurses. They are required to meet with doctors, often psychiatrists. Often in that first 72 hours, they are prescribed medication. If they are believed to need medical or chemical intervention, that takes place at the facility. Again, all of this is done in a 72-hour window. No consent, no signing off, no agreement. It's just done. They are often put in rooms with other individuals. They are held to a strict schedule. They are only allowed to go to certain areas. I can personally say I've been to these facilities. I've visited my own clients in these facilities. My students at the graduate level that work in these facilities, again and again, I see this type of thing happening, and I want you to be aware of it, because I understand that it has become a pretty common thing to hear that, oh yeah, so-and-so was Baker acted, or so-and-so was involuntarily committed to the hospital. And I don't think there's enough information circulating about what that looks like. It can be extremely traumatic. It can be extremely scary. It can leave emotional and mental scars, especially if a child is sensitive, if they have attachment issues, if they have anxiety. It can just ramp all of that up so high. So I want you to know, I want you to have information so that you can make the right choice. I would always err on the side of, unless your child is actually going to immediately harm themselves, that think through that and process whether or not that weighs better or worse than letting whatever's going on play out. So much so, this has become a growing concern in the mental health community. I just read an article pretty recently that a representative in our state of Florida is trying to pass legislation and putting a bill through that says schools can no longer Baker Act children without parental consent and notification, for that very reason, because kids as young as 5 years old have been handcuffed and put in the backseat of a car and driven from school to a mental health treatment facility, or sometimes even a hospital. I'll speak to that really quickly as well. I live in Trinity, Florida. Orlando is about an hour and a half away, and one of my personal clients was Baker acted. Dad called the police came, the police Baker acted her. None of the receiving facilities close to us had any beds. They were all so overcommitted with Baker Act patients. They shipped her all the way to Orlando, which is an hour and a half away. And she spent 3 days, an hour and a half away from home at a hospital, because all of the local hospitals were full in their Baker Act receiving units. That is the epidemic that's happening. That is the scenario that's going around in Florida related to the Baker Act. So I want you to be aware. Please think and consider and educate yourself before that decision would be the one that you would make. I would never want something to long-term influence your child in a negative way. And unfortunately, I see lots of evidences that when children are Baker acted, they struggle with the experience for a long time after. So food for thought. Obviously, educate yourself, do your own research, but please just be aware it is not an experience where it's positive. It is often very scary and traumatic. And like I said before, sometimes it's necessary, but most of the time I don't believe that it is necessary for kids. So please keep that in mind. And I hope that you find that helpful. I know it's not a fun topic, but I think it's so relevant and important, so I wanted to share it with you. Thanks so much for watching. I'll see you again soon. Bye.